2, 1. Hello and welcome to the Health, Hospitals, and Social Services Committee meeting on Tuesday, September 15th. It is 4:50, and we want to start. We have a legislative motion that I would like to start with. Well, prior to that, want to see if we can do a roll call for attendance. Individuals in the Health and Hospitals Committee, if you would raise your hands on the WebEx screen.
Mr. Chair, you're going to verbally acknowledge those who are raised.
I am, yes, sir. All right, we have Councilmember Welsh, Councilmember Pulley, Councilmember Porterfield, Councilmember Hauser, Councilmember Benedict, and Councilmember Taylor. Is there anyone that I've missed? Councilmember Benedict, Porterfield?
Yes, I'm here.
Okay, Pulley, Welsh, Hauser, and Taylor. Okay.
Hurt is here.
Hurt, okay, and Councilmember Hurt. Councilmember Glover, present. Councilmember Hall. All right. All right, so we have 6 members in attendance, or excuse me, 7 members in attendance, so we can start. We'll start with the executive order from the governor pursuant to Governor Lee's executive order number 16 regarding electronic meetings. As extended by executive order number 34, 51, and 60, I make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council, and that the meeting is electronically as necessary to protect the health, safety, and welfare of Tennesseans in the light of COVID-19 outbreak.
Second.
Thank you. And all in favor, please say aye.
Aye. Aye.
Aye.
All right, thank you so much. So we will start. Resolution RS 2020-530 by Toombs and Welsh approves a contract between the Metro Board of Health and the Tennessee Department of Human Services to provide services to establish paternity for fathers seeking voluntary acknowledgement of paternity for child support enforcement. Do I have a motion?
So moved.
Do I have a second?
I second.
All right. Councilmember Porterfield, I see your hand is raised, or not anymore?
That was an error. My apologies.
Okay, no problem. So do we have any discussion? Is anyone from the Board of Health, the Department of Human Services available? Would like to add anything? Okay, seeing none. All in favor, please say aye.
Aye.
Aye. Aye.
Aye.
All right. All against? Any abstentions? All right. Motion is approved, 7-4, 0 against, no abstentions. Next bill will be RS 2020-531 by Toombs, Welsh, and Swara, accepts a grant from the Tennessee Department of Health to the Metro Board of Health to build local capacity to improve public health response to the substance misuse epidemic in the Middle Tennessee High Impact Area, or the HIA. Do I have a motion?
So moved.
Second.
Second. All right. Motion's been properly moved and seconded. Is there any discussion? Seeing no discussion, any comments from anyone from Tennessee Department of Health and Metro Board of Health? All right, seeing none. Motion been properly motioned and properly second. All in favor, please say aye.
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 All opposed? Any abstentions? Resolution carries 7 in favor, 0 against, no abstentions. RS 2025-32, a resolution approving Amendment 2 to a contract between the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Board of Health and the Nashville Academy of Medicine to provide access to the Charisma Salis database system for patient and prescription tracking. Do I have a motion?
Move.
Second.
All right. Any discussion? All right. Motion has been properly moved and seconded. All in favor, please say aye.
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 All against? Any abstentions? Motion carries 7-4, 0 against, no abstentions. RS 2025-33 by Councilman Welsh approves a dental provider service agreement between the Metro Board of Health and DentaQuest USA Insurance Company Incorporated to allow the Metro Public Health Department to become an in-network provider with TennCare Cover Kids dental services. Have a motion?
So move.
Second.
Second. Motion's been properly moved and second. Any discussion? All right, seeing none. Is there anyone from Metro Board of Health that wants to discuss this or share anything? All right. All in favor, please say aye.
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 Any against? Any abstentions? Resolution carries 7-0 or 7-4, 0 against and no abstentions. RS 2025-34 by Toombs, Bradford, and Hancock accepts a grant from the Friends of Metro Animal Care and Control to the Metropolitan Board of Health to provide low-cost medical services and behavioral vouchers to assist in decreasing the relinquishment of animals.
So
We have a second. Second.
Second.
Any discussion? Do I see Councilmember Bradford or Hancock or Toombs?
I'll tell you, Mr. Sharp's having a difficult time being heard. I just got a text from him, so
Okay.
he's been trying to get in. He's got computer audio problems. So if you want anything from him, I guess he's going to have to call in.
All right. So Mr. Sharp, Councilman Pulley said if you could please call in and Councilman Pulley, if you could help us with his number. We have him here. Is anyone from ITS available to add Mr. Sharp as an attendee? I believe that's for a participant on the panelists.
He said he's on the phone now and can't be heard. If anybody wants to hear from him, I could probably call him and get him on the phone and put him on speaker. So that's just up to committee.
What's the first 3 digits of his number? Like 615?
Yeah, that's it. 615. I'm hesitate to put it all out on the air, but the first 3 are 615.
All right. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615. 615.
Mr. Sharp, are you on the line?
I think so. Can you hear me?
All right. Thank you, Mr. Sharp. We can hear you.
Oh, thank you. I'm sorry for all that. I've been trying for madly. I'm yelling at my phone and it didn't do much good. So I'm sorry. I lost track of where we are.
So, Mr. Sharp, we are at resolution RS 2020-534 accepts a grant from the Friends of Metro Animal Care and Control to the Metro Board of Health to provide low-cost medical services and behavioral vouchers to assist in decreasing the relinquishment of animals.
Yes, sir. One of the single biggest input we receive at the shelter are owner relinquished animals. A lot of times those may be relatively minor behavioral issues. They chew the furniture or, soil the rug, that can be corrected with a little bit of training by someone who knows how to do that. And the Friends of MAC, the support group, have raised money so that we can give vouchers for animal behavioral people and so the owner, rather than relinquishing their pet to the shelter, could get a voucher and go try to get that behavioral issue corrected.
Perfect. Thank you so much, Mr. Sharp. And I would like to, currently right now, Councilmember Toombs, Bradford, Hancock aren't in the meeting. We don't have a letter. Ms. Zeitlin, there's a second one that that Mr. Sharp can also discuss with us. Could someone help us have one of the sponsors to join the meeting so we can move forward with these resolutions?
So we could, this is Hannah, we could either try to get one of these sponsors in here, or we could have someone else who's willing to sign on as a sponsor and just email that to the clerk, and then we're good to go.
Hannah, this is Councilwoman Porterfield. I was raising my hand to say I will sign on as a sponsor.
Thank you, Councilmember Porterfield. Thank you. Councilmember Hauser, I see your hand is raised.
Yes, I have a question in regards to how the vouchers could be used. If the individual who has the dog relinquishes the dog because of behavior and they don't want to take advantage of the voucher, could the person who adopts that animal get the voucher for behavioral modification?
I don't see any reason why not. The staff, one of the things they set up over their last couple of years was a more formalized intake process. It used to be people would just basically abandon animals on the front steps. That is no longer the case, and it's been a lot of people, if you talk them through the options that they have, do you have a relative or a friend or somebody that you know that's looking for an animal rather than giving it to the shelter, because you cannot guarantee the outcome for the animal if we take it in the shelter. Yes, I don't see any reason that wouldn't be possible.
Do we have to write anything into this to make that clear, or what do we need to do to make that happen?
I don't think that'd be necessary. The shelter staff will know that the animal came in due to some behavioral problem, and it could be the animal, and frankly, sometimes it could be the people. It might or might not have the same issue when it goes somewhere else. But if it's a recurring thing and they will, I would assume, and I don't know this, I can check. I would assume they'll tell them this animal came in because it was a furniture chewer or whatever. And they might even do that on their own to try to make it more adoptable.
Okay, great. I just wanted to make sure that the animal still could be trained if someone else took the animal. Thank you.
Yes, ma'am.
All right. Thank you so much, Mr. Sharp, Councilmember Hauser. Do we have any other discussion? Seeing none, it has been properly moved and seconded. Resolution 2020-534. All in favor, please say aye.
Aye.
All against? And Any abstentions? Great, thank you. Motion passes 7-4, 0 against, and no abstentions. All right, moving on, RS 2020-535 by Toombs, Bradford, and Hancock. A resolution accepting a grant from the Friends of Metro Animal Care and Control to the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Board of Health to provide low-cost supplies to assist in decreasing the relinquishment of animals to, I'm so sorry. Accepts a grant from the Friends of Metro Animal Care to and Control to the Metropolitan Board of Health to provide low-cost supplies that assist decreasing in the relinquishment of animals to Metro Animal Care and Control. This is Resolution 535. Mr. Sharp, do we have a motion?
So moved.
Seconded.
Second.
Mr. Sharp, do you want to discuss this one as well?
Yeah, I've just asked Lauren for specifics on what most of those are. I think they're primarily mostly kennels, so people can transport the animal or have a way to keep them out of underfoot at home on occasion when they need to. I will tell you though that these are coming in as grants like this because it's not just a donation. Matt can accept just a donation. The fact that they have specified these two things for the uses of these monies suggests to me that they are aware that these are specific needs at the shelter to try to tamp down the owner surrenders. And I don't know exactly what those low-cost supplies are specifically, but it does tell me that they've targeted this money to a specific issue.
Thank you so much. Councilmember Porterfield.
Thank you so much, Chair. If none of the sponsors are here and if there's not a letter, I would like to sign on to this one as well.
Thank you, Councilmember Porterfield.
I just arrived, but I would love Porterfield to sign on too. Hi, this is Councilmember Hancock.
Councilmember Hancock, thank you so much. We are on Resolution 2020-535.
Thank you.
Do you have anything to add, Councilmember Hancock?
No, I just know that Metro Animal Control, does a lot of great work. They have been behind the 8 ball with budget cuts over the last few years. And then in their transition from MNPD to health services, they've really focused on trying to utilize grants to help fund the things they need to do to take care of the animals.
Good deal. Thank you, Councilmember Hancock. The resolution has been moved and properly seconded. Any more discussion before we take a vote? Seeing none, all in favor, please say aye.
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 Any opposed?
Aye.
Any opposed? Any abstentions? All right. Resolution passes 7 in favor, 0 against, and no abstentions. We have 2 late file items presented by Councilmember Toombs, a resolution to appropriate supplemental benefit grant funds from the Tennessee Housing Development Agency to the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Action Commission for Low Income Home Energy Assistance Program, or LIHEAP, services targeted toward the elderly, disabled, veterans, and households with children under the age of 6 years. Do we have a motion?
Move to approve.
I'll make a motion.
Second.
Motion's been properly moved and seconded. Do we have any discussion? Is there anyone from, I'm trying to look and see, anyone from Metro Action Commission?
Yes, sir, I'm on.
Okay, perfect. Thank you so much. Would you like to give us a bit more detail in regards to this resolution?
Absolutely. So the state of Tennessee has decided that any individual served from our agency from October of 2019 through the end of July of 2020 will automatically receive an additional supplemental to help with their energy bill. That number is approximately 9,000 individuals in Nashville. The next bill that's coming through for us is also for the same purpose.
All right, thank you so much. Council members on the committee, anyone have any questions, any discussion? All right, perfect. Seeing none, I'd like to take a vote. All in favor, please say aye.
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 Any opposed? Any against? Any abstentions? Resolution passes. The second late file resolution, late file resolution presented by Councilmember Toombs, a resolution to appropriate the grant funds from the Tennessee Housing Development Agency to the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Action Commission for Low Income Home Energy Assistance Program, or LIHEAP, services targeted toward the elderly, disabled veterans and households with children under the age of 6 years. And we heard the explanation. It's coming in for the same thing. So do we have any additional discussion? All right, seeing none, all in favor, or excuse me, do I have a motion?
So moved.
Perfect. Second.
I'll second.
Thank you. All in favor, please say aye.
Aye.
Any opposed? Any abstentions? All right. Resolution carries 7 in favor, 0 against, and no abstentions. That concludes the agenda for the committee. I'll entertain a adjournment motion.
So move.
All right. Thank you so much. That concludes the meeting for today.
Latest beverages committee, do I need to count down?